your hair doctor should know. If you're a professional in this industry, you should know what you're putting in people's heads. So you should be counting every graft and how many hairs are in each graft. If you are doing either a linear or an FUE surgery, you will see that grafts underneath the microscope have 1, 2, or 3 hairs. Only single hair follicular units, which is a graft, go at your hairline. So the number of hairs actually is counting up all the numbers of hairs per graft and then adding all those together. But the number of grafts might be lower depending on how you separate the individual hairs, okay? So if you want density, and you've got a site here and a site here, you're going to want to put a 2 or 3 hair follicular unit in one site and a 2 or 3 hair follicular unit in this other site. If what you want is natural, diffuse beginnings of a hairline, then what you want is single hair follicular units in each site. So you want to have higher numbers of hairs per graft if you're looking for density. And if you're looking for something like eyebrows or a hairline, you want a single hair follicular unit in each one of those. Now, the number of sites is different. You can actually place more than one graft in a site. You usually don't want to do that. If you're going for density and all you have is single hair follicular units, occasionally you will do that. But your doctor will tell you that in advance. Usually you don't want to do that because it results in something called piggybacking. In other words, usually the second graft pushes the first graft down into the hole and you end up having a little bit of folliculitis. So it grows like a pimple. Now, folliculitis can happen in normal healing surgery. So it's not always the case that somebody is piggybacking, but that often will happen if you've got a lot of piggybacking. I hope that explains the situation. And remember, you got to ask your doctor this if you're the patient, because some doctors actually will transect 3 hair follicular units into 3 individual hairs that they're transplanting and then call that 3 grafts. And they particularly do this. This is an area of unethical behavior in my industry. They will usually do that if they're charging you by the graft because that triples their revenue. So make sure you know exactly what you're getting when you're the patient. Good luck.